in Congress, pushed, rushed, a lot of assumptions being made, a lot of misinformation. I asked Dr. Vitarello to come on and explain some of the facts to us. And Doug had a great question. Can you talk about the differences about what someone would get under the British system, which is the system that they keep glorifying, like it's so wonderful, it's the answer. Can you give some examples of what someone may get under that? Right now, we've identified that no one is denied emergency care in this country. It's against the law.
Absolutely, and that's a great question. I think, Doug, that's a very good question. Let me go over that real quick with you. The National Health Services in England was established in 1948, and it's a 50-year pilot. It's very interesting. After 50 years, they were supposed to reevaluate, and they did it in 1990, and the report came out, Delay, Denial, and Dilution. It's a report on by the British on their own healthcare system, and they gave it a big D minus, an F almost. Delay. And what they're saying basically, if you look at the British system over here, it's socialized medicine. And if you look how they practice it is by rationing care. The first thing is if you want to look...
What's that term again?
Rationing care. What they do is they say, here's an example. If you're older, over the age of 64, wow, I'm 57, okay, you can't go into intensive care unit to get dialysis unless your primary care doctor agrees to it. 2, if you're overweight, you won't get a bypass or angioplasty or a prostate surgery. Wow. Sorry, you're overweight. And that's in the eyes of the beholder. If you're 20 pounds overweight, 50 pounds overweight, a lot of overweight people in the United States, they're not intentional gluttons. That's the way they're built genetically. But in their system, you won't be treated unless that primary care doctor in England says you may have it. They don't get it usually. Next, smokers. If you smoked, you won't get an angioplasty or a bypass. It's an addiction. You have to look at it as a disease. You cannot say, I won't give you an angioplasty because you smoked. You saved their life first, like we did in Frederick with 170 people, then get them off tobacco and work with them. What you're playing is God. Say you smoke, sorry, you don't get it. And then if you have a mild memory impairment with dementia, you don't get it. So, but they let 1/7 of British people pay for it. The rich get it. So it's a two-tier system. The rich, like the Kennedys,
so if you got the money,
you got it, 1/7. And what they do is they limit care. And the delay, it was called delay, denial, and dilution. Delay means this. If you want to get a bypass, they only bypass 300 people in England per million. Here in the United States, 2,000. Think of this real quick. Say, okay, you got disease and you need to get a bypass. They make you wait up to 3 months to a year to get your bypass. In the interim, many people die. They stroke out and lose their heart muscle. Now, denial, they deny you care if you have those other things I just talked to you about. And dilution is, in London Hospital, and I trained there for pacemakers, they only had 8 cardiologists on staff in London Hospital. We have 16 in Frederick. They don't create specialists. So if you had a stroke in, let's say now in England, only 3% of the times were you seen by a neurologist. That's scary.
And you've worked in this environment.
I taught in Italy in a medical school there. I worked in Mexico for 2.5 years in medical. I've seen the other part of the world. And trust me, you don't want your care then. Now, let's talk about some outcomes.
I was talking to Dr. Vitarello, so the point I'm trying to make, he's been there. This isn't something he's reading out of a medical journal or he's drinking the Kool-Aid. He's been there in the trenches in those types of systems, so he's speaking from experience. I'm sorry.
Absolutely, and I worked in these hospitals, and it was a great experience. You learn a lot, but if you look at the UK, Britain versus the United States, here's for the ladies in our world here, and for your wives and moms and sisters, they have a 88% higher mortality rate, 88% of breast cancer deaths, 88%. That's horrendous. For prostate cancer, for us, remember, 80% of men will get prostate by the time they're 80 years old. All of us get it. Check out this mortality. You're going to really die in this one. 604% increase death rate on prostate cancer for men. For colorectal cancer, 46%. For heart attack, 54% less survival rate because you don't get your bypass. Now, if you need dialysis, you don't get it after 64. If you need to go to an intensive care unit over the age of 64, you don't get it unless that doctor approves you. So really, they ration care. And if you need a CAT scan of your brain, like you fell off your bike or skiing accident, it has to be approved by the chief radiologist at the hospital. They limit CAT scans. There's a quota. They actually have a quota sheet. If they hit the quota of 300 that month, they can't do it through engine 1 unless the guy says, yeah. Well, didn't someone recently fall off a little ski? Yeah, absolutely. She bled in her brain. She was in Canada. What happened? She died because they didn't have a helicopter service. If she was in the United States, I guarantee you if she was in Ski Liberty, we have great docs in the ER here. They would have get a CAT scan, picked up, and saved her life. In England, they ration care. And when I was operating there, the lady told me, listen, Dr. We're used to dying. I lived through the Battle of Britain. We're used to getting bombed by the Nazis. Well, guess what? That war's over. You shouldn't die early and younger just because you have socialized medicine. None of us want socialized medicine because we know what happens with the mortality and morbidity. And plus, the government runs it. These are the same guys who brought you FEMA and Katrina, right? Mm-hmm. Do you want the mail 4 days a week or 6 days a week? Do you want to see a doctor 4 days a week? Don't think so. So really, they've proven consistently that they're not good managers at all when it comes to health care and other things we do in our government. So I think the American public has a right, and that's why the Senate put the brakes on this, because of the cost, and people are smart enough to say, hey, I'm not giving up my health care, because they're telling the elderly right now, the AARP was told, you had your good innings in life. Yeah. The game, you played it, and now it's off to the twilight in your 70s. You can't get your hip repairs, knee replacements after 80 or 75. You won't be put on ventilators after a certain age, because built in this new bill is a panel of 5 men and women. They didn't tell you about that. Who are these 5 men and women making decisions for the entire health care of America? They're usually people that work for HMOs and insurance companies and doctors that work in universities sometimes that don't treat patients. So would you want your dad denied a hip? Do you want to not be put on a ventilator when you're older? Absolutely not. They're going to ration care. And that's where Obama is not telling us the facts. He talked to AARP, and when they asked him, would that mean rationing, he turned around and said, well, we're going to save money.
That was his answer.
He's going to save money. And then he had the guts to say, a red pill versus yellow pill, meaning sometimes the red pill saves your life, and you have to spend that money. And don't you judge a country and how much they take care of their elderly? Absolutely.
Sure.
And that's why the United States is the best.
Well,
and I don't think we should ruin it. And 75% of Americans...
They've helped build this wonderful country. Why would we deny them care?
Absolutely. Think of all those guys who went to Vietnam, Korea, World War II. They fought for our countries. And now we kick in the VA hospitals, and guess what? They get their acute care out of the VA hospital system. And 75% of Americans are happy with their insurance.
And we've established that, first of all, no one is denied emergency care. It's against law in this country.
Absolutely.
And I've always felt that we should take care of our elderly. They help build this wonderful country that we enjoy, and many generations after us will enjoy. And, of course, the children. I've always said, I think everyone is compassionate that when a child is sick, they want to help them, whether it's an emergency or something basic to a toothache.
Absolutely. And the people in this country right now, there are 2 government-run programs, Medicaid and Medicare. People in the poverty level in our state are covered by Medicaid, but half of them don't even apply for it. So when they come to our hospital for a heart attack, half of them don't even fill out the paperwork. They have a plan there that we've paid for, but they don't utilize it. So it also takes personal responsibility.
Sure. And accountability.
Accountability. Like, you can't blame McDonald's if you're overweight and sue them.
That's right.
And you're not going to get $51 million because, you smoke, you know is bad. That's baloney. The lawyer made all that money. It's a scam. This is the same scam that brought you the Citicorp and all this other nonsense. The American people are smarter. Now we're at the point of the debate where I think, and Obama has many good things about him, but I think right now he's using his charm, and it's not working because people want facts. And he can't give them the facts because he doesn't know what the facts are yet. There are many bills out there. We're going to talk about the options. But most importantly, he can't tell them to their face they're going to ration care. The American public will revolt if they hear this. And there's other ways to save money.
All right, let's take a quick break, talk with Dr. Vitarello. We'll talk about the options when we come back. Chief Cardiologist at Frederick Memorial Hospital. Phone lines are open if you